Good afternoon, everyone. My name is Sarah Barker here with Connect Our Elders, and today I'm very pleased to have Adam Corcoran. He is the Director of Business Development for Golden Care in Florida, and he's also the President of Home Care Flyers. Thank you so much for being with me today.
Sarah, thank you for having me. I greatly appreciate the opportunity to come on the stage with you and just kind of talk some things through.
Oh, absolutely. And I love the fact that you're a hustler. So, like, you've got your full-time job and then you have that entrepreneurial spirit. And it's really amazing how you're able to merge your experience with your full-time job into what you do with Home Care Flyers. So with that said, could you go ahead and share a bit about, give us in a nutshell what Home Care Flyers is?
So, Home Care Flyers is a full service graphic design and printing company. We actually also do promotional products. We found this opportunity back, actually, believe it or not, during this pandemic. As crazy as that sounds, if 2020 has shown us anything, we've had to adapt, right? And adapting in multiple facets. Um, a little bit about myself. I'm from New Jersey originally. Don't hold that against me. I'm one of the good ones. And my mom was a director of nursing for a home care agency all growing up. I ended up getting into home care space about 7 years ago. I worked for a franchise model for a couple of years and then had the blessed opportunity to take a privately owned company off the ground, Golden Care. So with that comes a lot of creation. So I'm a self-taught graphic designer since I was, a little 13-year-old kid in middle school. And it was so fun to take a private duty home care agency off the ground and create everything that we need, from brochures, our business cards, our flyers, really diving deep into our different programs that kind of separate ourselves from everybody else. But with that being said, in 2020, I found the opportunity I had a couple freelance graphic design clients that I've worked with. And I said, why don't I really lean in on what I know best, which is home care. So Home Care Flyers was developed in 2020, where we have the opportunity to really elevate home care owners the ability to have a professional brand. I think there's so many people who don't have the backing of a franchise, right? They start a privately owned company and they just need that professional touch. So I'm very blessed with the opportunity to work with a lot of home care owners across the nation to really help with their branding, from business cards, brochures, help them with some of their programming, and really bring a huge spruce to their brand. And I've done logo designs for a ton of agencies. So it's a lot of fun.
Well, you certainly have an amazing reputation. I mean, I know numerous people who have used your services and they're very impressed. And, I put out a request for something and I think you popped up. I think everybody mentioned you. So you're doing a great job with that. Let's spend a little bit of time discussing the importance, because there are some people that think, well, you know what? Why would I even get brochures? Why would I even do this? Because all the discharge planner is going to do, the only thing the social worker is going to do, they're just going to throw it in the trash, or they're going to add it to the pile of all these other flyers that they have. So let's talk about two things there. Why is it still important to have these brochures? And then how is it that you're making your material stand apart from the others?
Right. So a couple things, and especially with times like right now with COVID, where face-to-face opportunities are minimal, right? And the opportunities of leaving materials behind is at a height. So you want something, you want brochures, you want flyers that are going to work for you. And I'm going to say that again. You need printed materials that are going to work for you. And what I mean by that is you want to be super intentional when you have these pieces that are going to help educate our referral sources to pick up that phone and call you, and not the other 40 home care agency brochures that they have. So a little fun fact is I used to be a school teacher. So when I was a school teacher, I take a lot of the same principles of when I was in the classroom to what I do here today in the home care space. So my first couple years in the home care world, being a good salesperson is really being a good listener. Okay. And being a good listener is understanding where their pain points are and where there are gaps of education. So finding those gaps of education and creating printed materials to help fill those gaps. So I have flyers on, like, so I'll give you, for instance, we did a kind of marketing blitz on primary care physicians, and we would go in and like ask them those hard questions. How often do you utilize private duty? And we get numerous amounts of answers. Oh, we use home health a lot. Well, you really don't understand private duty. So we went in and we leaned in on saying, okay, we need to create a specific flyer on the top 10 reasons why and when these clients would use private duty home care services. So it's a very digestible flyer that now primary care physicians trigger. Okay, someone's a fall risk. Now it's putting in their head of, I see 40 patients this week. Who's a fall risk? That's a good opportunity to refer to Golden Care, whichever home care agency.
That is an excellent example, and absolutely no disrespect to physicians, right? But it boggles my mind, whether I was working for home care or representing hospice. A lot of times physicians do not know the difference between if they're going to do home health or home care and the differences between the two, right? And so
Right.
creating that material that is going to be educational and help them identify opportunities to refer, it's so much more than just, the opportunity for the business, but you're actually educating them so they can better help their patients, right?
Yep.
And that's
Exactly.
really interesting because lots of times brochures are just descriptions of the services, right? Not educating on how to identify people that need help. So that's an excellent example of how you guys separate yourselves.
Yeah.
That's
I had a
wonderful.
long conversation not too long ago with a client of mine who's a home care agency up in the Northeast. And he's like, I'm just so sick of seeing the same exact brochure. I want to stand apart. So we're working together on like telling his story. It's very personalized. You want to separate yourself from the rest of them. I mean,
Mhm,
it's
mhm,
crucial. You have to. And let's be honest, it's your company's first impression, especially if
mhm.
you don't have the opportunity to have that face-to-face meeting and it's something that you're leaving behind. You want something that's going to look credible, look professional, that you're going to have that opportunity to take that relationship to the next step.
So Adam, when somebody comes to you and they say, I need some marketing materials, what does your process look like for these home care company owners?
So I asked them to go to our landing page at the current moment and really just fill out a simple form to get a little bit understanding of like where they're at in their business, right? Where they're located, are they the owner and what have you? And then I have a colleague of mine, Ashley. She's amazing. She's doing kind of the introductory call. So she'll start a dialogue either by phone or email back and forth to get a good understanding. In that form, it asks like, what are their priority items, right? Is it business cards? Is it brochures? What's your budget look like? We want to help you through this process, right? There's a lot of home care owners like, I want everything, but they can't really afford everything. So let's talk
Mhm,
that through. Let's talk it through a little bit. Let's see what is a priority. What are the things
mhm.
that I can give some, advice on in regards to their starting points, and then kind of elaborate. People have to
Okay.
understand marketing materials is an investment. And I don't think a lot of people have a good understanding. If you did the math on the return on investment of your printed materials and you did a good job of tracking, right? I picked up this brochure at Dr. Smith's office, right? And track that, because again, it only takes one client to really make that worth it.
Oh, absolutely. I mean, I was thinking about, with some other work that I do, and I was trying to justify how I would charge home care company owners, thinking, well, they wouldn't pay for that. And then it dawned in my mind, seriously, if they get one client that's even, 8 hours a week, they're more than paying for it, right? So imagine if they
Exactly.
get like 2 24/7. So, it's definitely understanding what the return on investment is. And you can't, I'll stress this to the audience right now, like you need to have marketing materials. As much as you feel like it's just going to be thrown away, it is such a instrumental part to the business. It's part of the legitimacy. And so if you can work with Adam and home care flyers and actually make yours stand apart from the others, I would suggest doing that. um, okay, so the process for them, they go to the landing page, and it sounds like you guys have these intense conversations about what is your story. Let's not just describe the services, but what's your story and how can we tell that through the marketing materials. And so that's print. Now, when you create these, when Home Care Flyers creates these for the home care companies, can they also still, do they use the digital version of that, or is that separate? How does that work?
Yeah, absolutely. And I encourage people to, right? I mean, I want them to have access to a multifaceted type of approach when you talk about your marketing strategies. So especially in, communities or facilities that you can't necessarily get into and even drop stuff off, you still have this deliverable that you could follow up with an email and saying, hey, here's this educational piece. You could drop it into a drip campaign and making, again, a very intentional piece that's going to help educate those referral sources to get your phone to ring.
Okay, okay. So you're talking about intentional pieces, right? There's the basics, business cards, your trifold brochure. Um, Sounds like when a home care company owner starts working with you, they can stay with you for all of their future marketing needs. Like, hey, we're gonna launch this new, hospital to home program, and what do we want the
Mhm.
verbiage to look like and the images, and they could work with you guys on that type of initiative as well.
For sure. Well, and one thing, as you know, about branding is staying consistent. I know so many people who get their logo on Fiverr and go to Vistaprint or the Office Max or Staples or whatever, right? And they're getting their pieceworking all this together. And when they're pieceworking this together, their brand gets convoluted. You want your brand to be very cohesive because, again, that's what's going to separate you. Nothing makes me happier when someone glances at our logo and they know it's Golden Care, right? And they know what we do. It tells your
Yeah.
story for you. So I think when you talk about staying consistent is so very important. We've actually just branched into promotional products and kind of really going a little bit deeper into that as well because I think those also have an impact on your business. Now, I'm not saying that every home care agency has to go out and buy thousands of pens, but there's certain strategies that I've seen in the past, 7, 8 years that I've been in sales and marketing for home care that I know that work. I literally just had one of my assisted living marketing directors text me. I gave her one of those tumbler cups, like the double insulated cups, kid you not, years ago. And she texted me on Friday with a picture of her. Like it was kind of like chipping away. I'm like, well, look, you've had it for 3 years. But he's like, I don't leave home without it. But it's like that brand recognition. You want to stay in front of those people. And there's certain ways you can do that in a very creative way. Awesome.
Oh, so Yasmin, one of your clients, she says, Adam is the best. He did all of my devoted caregiver supplies. I'm not sure if
That's
any of you in
awesome.
the audience recall, but Yasmin was our last guest, and we have a client together right now, a couple. She is amazing. Started out as a caregiver, now owns her own home care company. Thank you, Yasmin.
Yeah,
Um,
she was wonderful to work with. I did pretty much everything from her logo design to car magnets. So I love working with her.
I love her story. I love her whole life story with her and her husband. Oh, my friend Jolynn. So we worked at Home Care Assistance. Thank you, Jolynn. Thank you. Okay, so back to the promotional materials. Okay, I want to talk about the business card for a second because I need your help. I thought, okay, well, let me get on Vistaprint, and I designed it. And on the layout, on whatever platform, I was like, wow, this looks really cool. And so I ordered them. They came in the mail, and it does not look like it looked like in the picture when I thought, because I did the designing and I have no idea. So we'll have to talk offline about getting that.
And that
And
happens. So in some cases, I mean, you have intentions of having something that you think is going to look, and there's so many aspects to it, colors, and so for sure.
definitely. Okay, so let's talk about home care. Oh, real quick before we move on to some questions. Masks. I don't see them going away completely anytime soon. I split my time between California and Tennessee, and the county that I live in when I'm in Tennessee, they've lifted the mask mandate. But in general, I don't see it going away anytime soon, especially for those that are working in healthcare. So, would you like to share with the audience about how you make these masks and they look amazing?
Yeah, so it's actually one of our first products that we really launched with Home Care Flyers and now Home Care Promo, because we saw it early on. We like you said, we don't see masks going away for in the near future, and even if the mandate they do lift the mandate, right? I mean, I think companies are still going, like grocery stores are still going to have their own policies where they're going to require them. I think people are going to be wearing masks on airplanes for a long time.
Hmm.
So, I mean, it was one of the first things that our company, Golden Care, really invested in is we got 200 masks right off the out the gate when COVID kind of started. We got them all to all of our caregivers. Um, it's a very intentional promotional product, right? It's being utilized for a purpose, but it's also a brand play. I mean, it's a walking billboard. If I have 50 caregivers, within assisted living, I mean, there's nothing wrong with your logo being passed by all these residents and family members or staff all day long.
It's so true. We may as well make the most of it, right? Like if we're going to
That's
have
it.
to wear the masks, let's go ahead and emphasize on that. So if
Yeah.
anybody needs masks, you can reach out to Adam for that too. And they look great. Yasmin, one of the home care owner I was just talking about a few minutes ago, she has them, and I can't believe the quality.
Yeah.
So.
Yeah, and it's actually a cool design. So we make it fun. Like we do like a little graffiti background and implement all of your colors with your logo kind of dead right in the center. And it's awesome because it's different than any other mask, right? So it stands
Mhm.
out. It's attractive looking. It's something
Mhm.
that people are going to stop and really like look at. So and
Mhm.
that was the intentions behind the design of it.
Yes, they're beautiful. Okay, so let's get into some questions, some direct questions that we discussed instead of. I'm a very curious person, so I hope you don't mind all of these off the cuff
No, love it.
questions.
Love it.
All right. So home care in general. I know that you mentioned your mom was a director of nursing, but what made you decide to get into home care?
Yeah. So if you would
It's
have
not
asked
an
me
easy
10,
beast.
no, it's not. It's not. And I just had this conversation with someone today, actually. If you'd asked me 10 years ago, would I ever be in the home care space? I would like, no way, like no chance. Um, I'm a big believer that your career finds you and you have to have purpose in what you do. And one of the things that kind of I kept on gravitating to is having the opportunity to enrich people's lives. And as I said, I was a school teacher for a number of years, and I enjoyed that while I was in the classroom. But I have a marketing background, design background, what have you. So I went back to my mom. Like, what do you do? I mean, whatever age you are, you go back to mom for advice. And she's like, why wouldn't you get into home care? And I'm like, I'm not a nurse. And she's like, you don't have to be a nurse to be in home care. Well, I took the plunge and I did, and I never turned back. I mean, if you really look at your day to day and lifting your head off the pillow every single morning, what's your purpose? Like that's what you really have to think about.
Yeah.
I know it's cliche to say like if you love your job and you never have a job in your life or what have you, but it's true. Like if you really look at what you do with full intentions and your purpose, everything else falls in place. So
Hmm.
I love the experience. It's not easy. No, no way is it easy.
Home care is a grind. It can be very fulfilling, but I tell when I train home care sales representatives, right? I'm like, I'm not gonna I'm not gonna BS you, right? Like you are gonna work a lot and it's going to be a grind. And then, you'll get into the swing of things, but it is so satisfactory. It's so satisfying because you're really making a difference in people's lives. And a lot of the times, by the time that they reach you, they don't, I like to say they don't know what they don't know. I know it's simplifying it, but it's true. Like they're coming to you and they are in crisis and you can alleviate a lot of the crisis that they're feeling.
There's no better feeling, and I've said this for a long time. Look, the paycheck is great, right? That's going to happen. Keep the lights on, keep the food on the table. But there's no better feeling than leaving that home and having a daughter, son, husband, or wife just like in tears, like relieved, right? Because
Yeah.
they know at the end of the day that your agency is going to take a huge burden off of their plate
Hmm.
and ultimately help maintain people's independence, live longer. Again, it's about enriching that time. I mean,
Hmm.
people have this mindset: I get old, I have to stop living. No, like Now you have support. So what does that look like today?
Yeah, I used to like to tell families, or I still do, which is, listen, I'm not here to take away your independence. I'm here to help facilitate your independence for as long as we possibly can.
Right. Absolutely. Yep.
Awesome. So, having the experience that you have in the home care space, you kind of mentioned it at the beginning, but let's go ahead and reiterate it so additional audience members can hear it now. So, you have the experience in the home care space and you're still operating in that space. What was the reason you chose to start Home Care Flyers?
Well, I think just to reiterate, it's more or less just giving people the confidence to go out and represent their company with a level of confidence that they never had before. And again, not knocking anyone who does their own flyers or brochures or what have you. And trust me, like there's a lot of programs that are allowing people to get very savvy, like Canva. And look, if you use that, I support that. But I've also seen some things that like people are struggling with creating their own materials on like Word, right? And they're like they know they just need that next level. I remember early on, I worked with an agency owner up in the Virginia market, and I practically like went all in with her. Like she was like all in and investing in a total rebrand. Like she had her logo looked very clean, but she just needed materials. So
Mhm.
we went from, like flyers, brochures, and she called me that next week. She's like, "I can't thank you enough." And I'm like, "Well, for what?" Like, like, yeah, for sure. She's like, "No," and I say this over and over again. She's like, "You gave me the confidence to go out and market." And I'll never forget that moment because like it's second nature to me. That's what I do on a day-to-day basis, right? So I've been doing this for a while now. But for some of these newer owners or even owners that have been doing this for a while and are hitting like those struggle points, it's like let me give you that confidence. Let me elevate your brand to go out there and take action and really see results. Another owner called me on like a Thursday night and they had an in service with social workers the next day. And she's like, I have nothing. Like, I literally am going into an in service with nothing. And I kid you not, we worked until like 1 o'clock in the morning. And I was like, look, I don't care if you print this in your home or go to Staples the next morning. You need like 20 copies of these things tomorrow. And she
Mhm.
did. She crushed the in service and she got her first 5 clients from that meeting. So it's like, these are, when I talk about the purpose of what I do in the home care space, it's just as impactful in being able to help these agency owners kind of gain that confidence and see results.
You are supporting them in their success, and I would say, expediting their success, right? And so those are phenomenal testimonials, and I love that you're providing confidence to these owners. I would like to add, because you were saying, and I used to have a bad habit of doing this, right? Sitting there and trying to figure out how to do something that's not my skill set. And then, so I would encourage all of the home care company owners right now, or care managers, right? Listen, if it's not your area of expertise, you can sit there and you can spend hours trying to figure out how to do this, and you'll probably come out with a subpar product, right? Or you can ask yourself, how much is my time worth? And what am I really good at? And maybe I need to focus my time over here and have home care flyers do this other stuff because they know how to do it. So it's going to be done faster, higher quality, rather than you spending your time, again, how much is your time worth? Hours and
Mm.
hours trying to learn some new skill set to create something. So just food for thought there. All right. So it says here that you specialize in long-term care insurance. Is that with, I'm assuming that's with Golden Care, right? And
Yeah.
okay, can you tell us a little bit more about that?
Sure. So a couple years ago, and with any marketing uh, approach, you want to find a core differentiator. And I early on found a trend in seeing a lot of people who had long-term care insurance policies that they knew nothing about. So it was after like probably like my fifth or sixth visit of like really diving into those policies and really reviewing them and educating myself about it and then like putting on like like that aha moment like all these people have invested into this product that pays for our services but they don't know how to use it. I'm like I have to find a way how I can really advocate for people. So we've been at this now for 2 years now. So Golden Care really specializes in long-term care insurance, and at the height of our census, we've had 50% of our census be on claim with long-term care insurance.
Wow.
So yeah, I mean it's a big deal, and if you look about it, I'm happy to help other people with this process as well. I actually was just asked to speak at the Home Care Association of Florida's conference here in July on long-term care.
Congratulations.
Thank you. So it's an exciting time because really, if they have these monies that are in a policy, they don't know how to activate their claim, or if they're at this alone, they really need some of that hand holding. Not always a daughter or son's going to be able to really help them through that. So it's an investment of our time and our dedication to following through with that process. Because if you look at the business sense of things, then right there's a feel good feeling about helping people gain access to monies to help pay for our care. But if you look at it from a business perspective, when you don't have to have your clients dive into their wallet, right? There's things that are going to occur. They're going to be more receptive to care. They're going to be
Mhm.
on services probably longer, right? I
Mhm.
mean, there's a lot of mental things to it, right? When you're paying for
Mhm.
something, you feel like you don't necessarily need it all the time, right? So you might only use services for a short period of time. If you have it being covered by an insurance product that you've already paid into, you're probably more apt to having it.
So let's talk about that for a second, because I've met with a lot of families where, right, typically they don't understand what their policy says, what it allows for, what their benefit is, right, or how to go ahead and initiate the claim. The other thing is that I've seen quite frequently is the elders themselves will say, "Well, I want to wait until I really need it. I don't want to do anything until I really need it." And so I learned over the years how to explain to them, I know that you feel like you don't really need it right now, but I would rather you get through the elimination period right now while you're only having to spend out of pocket 8 to 12 hours a week versus all of a sudden you have some catastrophic event and now you're having to come out of pocket 24/7, for during the elimination period. So educating them on that too, the proper time to go ahead and start moving forward with it.
Yeah, there's so many strategies to really work through that, and I have so many tips and tricks, and I actually partner very closely with assisted livings, with long-term care insurance, right? Because it's exactly what you said. Let's shrink your out-of-pocket cost. Let's get through that elimination period when your costs are lower, and then again on the 91st day, right? In most cases, you become benefit rich, and whether that means you're transitioning to senior living or increasing hours. But I hear you. I get that all the time. I don't want to run out. Do you know the statistic of how many people actually get through the entire policy is only 5% of people.
There's
So,
a
I mean,
reason why the insurance companies are so rich.
right? They're still in business for a while, for a reason. Yeah, exactly.
Well, you'll
Um,
have to come on. We'll have to do a separate interview where maybe you just give some sort of educational seminar, or, we'll just focus specifically on long-term care, because I find that it's an area that not enough people truly understand. Okay. How has COVID impacted your business? I know it really impacted a lot of placement agents, but how has it impacted Golden Care and how has it impacted Home Care Flyers?
So a couple things. I'll start with Golden Care. We have a sister company that's a Medicare certified home health agency. So we kind of saw a lot of the things coming before they were really present to a lot of people. So we're ahead of the curve. We've really never had any problems with getting PPE or being, tested or what have you. I mean, don't get me wrong, we've had our hurdles, as most did. Um, and I think we took a very, very, very proactive approach. When we saw this coming early March, we said, I literally had a heart to heart with my CEO and said, listen, there's going to be a ton of people that are going to put their hands up and say, I'm going to take the back seat and let this thing ride out. I mean, how many times did we
Mhm.
sit back and say, oh my gosh, I can't wait till next month when things are normal, right?
I know.
I mean, literally, it was like month to month. Like I think I mentally had this like benchmark of like, all right, every 4 weeks, like things should be normal again. But no, the reality is there's too many people that did, right? There's too many people that said, "Oh, well, we really can't do much because we can't get PPE." Or I think they created their own obstacles, right? And don't worry, there was obstacles, but they were can be overcome. And I think in home care, generally speaking, home care was so relevant during COVID that so many people didn't really understand. I mean, especially here in Florida, I can speak for our state because it's a very seasonal state. We have a lot of families that are far. We have an older population that, typically when mom fell, the son or daughter jumped in a plane from California and got here. That wasn't really happening, right? Because of travel restrictions. So we saw a lot of opportunities out of the hospital because people were not having the support that they once did with their family members.
A lot of factors. I mean, I knew numerous families who brought their loved ones home. They were
Yep.
at senior living and they brought them home, or also people who were in the process of going to a senior community, regardless
Mhm.
of type, right, then said, I don't think so right now, like we're going to stay home. So yeah, home care was extremely relevant and still is throughout all of
So
this.
we're
Hmm.
still seeing a handful. I just got a call today. A handful of people who are still weary of going into rehab facilities. I
Hmm.
mean, we're seeing people who are going in for full hip surgeries, going home in 2 days because they don't want
Hmm.
to go to rehab. Now, I mean, just as well as I do, someone recovering from a total hip replacement is going to need more than just their three, therapy visits a week. So
Yeah.
we're seeing a ton of those opportunities because the social work teams at the hospital are saying, like, fine, if you can go in for your elective surgery and you could refuse going to the skilled nursing facility, but you're going to need more help.
Yeah.
And that's where Golden Care has really positioned ourselves to really be the front leader in that transitional support. And honestly, in the 4 years that we've been active, we had our busiest months in July and August of last year, which is
Wow.
mind blowing to a lot of people, but it really made sense to us because we were ahead of a lot of the things.
It does make sense. Where exactly in Florida do you guys operate?
So we're in Southwest Florida. So we're based out of Naples. We have offices in Naples and in Fort Myers. So we cover Lee and Collier counties.
Okay, okay, wonderful. So, what are some creative ways, during COVID, but just let's pretend COVID doesn't exist for a minute, right? Like,
Yeah.
what are some creative ways that you've been able to stand out from your competition pre-COVID and throughout COVID?
Yeah, so I think, for the most part, I think what I see, and I've learned everything that I've known by doing the wrong thing first, right? And it's so true. It's like when I first started in this industry, I was like trying to do everything for everyone and be the referral, like the home care agency who is going to do everything, right? And there's a time and place for branding and marketing blitzes, and I don't discourage that. But I think there's something to be said. And like why we took such a narrow niche at long-term care insurance is because we know we're experts in that field,
Yeah,
right? So I have social workers that literally refer directly to us and only us when they have long-term care insurance plans. So it's like it's really about finding a niche and being good at that niche market.
right.
Um, and that's not saying like take your pedal off of your regular sales calls or marketing initiatives. But I think it's important to find what you're really good at. I mean, I know a lot of home care agencies that are diving into transportation or care management. And look, I don't discourage that. I mean, I like the idea of additional revenue streams, but I also think you should master one thing before you moving on to another.
Well, because it's a very real risk that if you try to do too much stuff, and I'm talking to myself right now too, right? If you try to do too much stuff, right, uh, you get spread thin, and as my husband likes to tell me, honey, there really are only 24 hours in a day, you
I
know?
still have a hard time believing that, but
Right, right, but it's true, and so, if you get hyper focused on the area that you know that you're good at and just increase your knowledge, right? And then what's that other saying that they say, like, that said, if make it easy for people to refer to you,
yep.
meaning make it super specific that as anytime they come across that opportunity, it's immediately that they think of you. But if if you tell them that you do too many things, in their mind, it's confused and cluttered. So they aren't thinking of you at all.
Yeah, I remember early on in my my career going in and just like blah 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 blah, and then like leaving there, I'm like, oh my gosh, like what did I just do? You know what I mean? It's because I wasn't intentional. And again, like I said, being a good listener, you don't need to be, you don't have to, you know, vomit, sales vomit everything that you do. You have to hear where their pain points are and find out how you're a solution to that person, right? Because everyone's solution, everything's going to be a little bit different from every
Mhm.
person. So it's just being very intentional.
It is. It is. I often tell some of the people that I've trained, right, is that, well, first of all, what I have found with some home care companies, usually the startups, right, they've gotten into it because they want to help, and that's admirable. But what I've found is that oftentimes they're not even sure who their targets are. They think, well, I'm just going to go to the hospital and I'm going to get referrals. And it's like, okay, well, that's good. But you do know that you have your legal financial bucket and then you've got your medical accounts, right? So legal financial, estate planning attorneys, financial advisors, trust officers, fiduciaries, CPAs, right? Medical discharge planners, hospitalists, hospice reps, home health, right? The list goes on. So it's like, okay, well, here you got to know who your targets are, but then also what's important to each one of those targets, because typically what's important to the estate planning attorney is not the same thing that's going to be important to the discharge planner. So understanding how you need to pose your message, right?
Right,
That's
right.
a another topic, but
I know we could talk for hours because I think there's so many good nuggets that are coming out of this that I think people need to hear, right? I think it's very important, and it's positioning yourself in different ways, but then following through on your commitment and being authentic. I think that's like my key word for this year is being authentic and genuine, because I think people can sense, you know, fakeness and people who are doing things for not the right reasons. Um, and that's why I
absolutely.
tell people be genuine. And if you don't know that answer, be honest. I mean, you know, people are going to applaud your honesty rather than you trying to wing it. You know?
Yeah, that's something that you everybody learns in the military. If you don't know, just say you don't know. Because if you pretend to know and you don't actually know, you could get people hurt, right? So be okay with saying that you don't know, but I'll find out the answer. Real quick, back to home care flyers, because I realized as I was saying how, there's the two buckets, the two types of referral sources, right? And within those buckets, you've got those different professions. I would encourage the home care company owners not to shy away from, not to say that you have to have a piece for each singular type of referral source, but I would consider having some marketing material that is specific to the legal financial referral sources, and then some that is specific to the healthcare type of accounts, right? Um, in addition
Yeah.
to your brochure and
And
your
like it's
business
like
cards.
going back to being a good listener, right? Understanding what they need and then creating something that's super easy for them to refer to.
Right.
It's a process, right? So it's not a one size fit all. And there are, you know, flyers and brochures that are very generic that you can use in multi, uses, which is there's a time and place for. But if you want something to be super effective, you're right. You want it to speak exactly to what where they're going to be able to refer. And as
Right.
you said, an elder law attorney's needs are going to be different than a social worker discharging 12 patients a week, you know?
Correct. Correct. So last question, before we close out here. What do you think your top key is to your success?
Ooh. Top key to my success. And I'm gonna go back to the word of just being authentic, and really being intentional. I've used that word so much and authentic so much because it's true. I think if you stay true to who you are, everything else falls into place. I've always been a person in the marketing sales roles of, you know, pounding the pavement and grinding, but not being aggressive.
Mm-hmm.
Um, and I think it's worked out very well, because I'm a big believer if you lead with education and you're a resource and a good community partner, the business follows. And it really does. And you know, I've seen it over time. Um, and your work speaks for itself. I mean, we could
Mhm.
all talk a big game. And listen, one little nugget of advice: you going in and telling someone you're the best home care agency is just like every other home care agency going
Yeah.
and saying you're the best home care agency.
Yeah.
Um, you know, it's really about following through on your commitments.
Yeah.
You know, and when I ask for business, I say, listen, you have so many options to use. I would appreciate the opportunity to prove to you that we can be a good resource partner for you. You know, I would love the opportunity to earn your business. They don't have to do anything, right? It's an honor and privilege to get referrals. So
Mhm.
when I look at our success, it's really about owning up to what you sign up for. And if you say you're going to answer the phone at 7 o'clock on a Saturday night,
That's it.
despite what, you got to do it, you know? So
I
that's
agree
really
with
it.
that.
It's really just being committed to everything that you've really signed up for.
I agree with that 100%. Something that was going through my mind was you're talking about authenticity, and it is so important because I've always believed that people can sense it, right? If you're not, they'll sense it. They'll read through you, especially people that are in healthcare because they tend to be more empathetic type people, right? So you can just feel it. So as I was thinking about it, I was thinking, home care flyers can take the authenticity of the person and bring it through the business. I was thinking something like that. Like home care flyers helps the authenticity of the owner show through the business, right? Because you're telling their story through the materials.
That's absolutely right. And that's why I said, like, you know, I encourage people to throw a bio. We just did an oversized brochure for an owner in Maryland. They just opened a second office, and you know, she put a bio into her brochure. I'm like, I love that. I mean, people want to see, you know, and again, not knocking franchises whatsoever, but like, you've seen one franchise model's brochure, you've pretty much seen them all. But
Hmm.
there's something to be said about that home feel, right? That
Hmm.
touch of authenticity and personalization. We are people too, and we're here to serve. So
Absolutely. So, Adam, if somebody is in the West Florida area, you said Naples and what's the other
Fort
area?
Myers.
Fort
Mhm.
Myers. Okay. So, if somebody's listening, they have a loved one or they have a client and they need caregiving services, right? Or home health in the
Mhm.
Naples or Fort Myers area, how can they reach you? And then also, how can they reach you if they want some assistance with their marketing materials?
Sure. So Golden Care, as I said, operates in Lee and Collier County. And actually, we see a lot of transitional, right? We have a huge snowboard population. So I actually have had a ton of opportunities to refer to the Philadelphia market, the St. Louis market. So the list goes on. So, you know, when we're part of all these groups, you know, we have a lot of transitional opportunities. So keep this in mind. Golden Care, we're available 24 hours a day. You can learn more about our company at goldencarefl.com, FL as in Florida.com. And then in regards to, you know, branding and printed and promotional products, if you are interested in taking that next step in enhancing your brand, you could reach us at homecareflyers.com. Fill out a simple form there, and we'll reach out to you to kind of get the ball rolling.
Thank you, Adam. As a reminder, my name is Sarah Barker. I'm the founder of Connect Our Elders. The entire intention of Connect Our Elders is to empower the aging process through providing education around elder care resources, to provide navigation through those resources, and then, of course, ongoing advocacy as you are connected to those resources. Thank you for joining us today. Adam, thank you so much for being the guest.
Thank you so much, and have a great day.
You too.